Okay.
Long axis distraction of the mortise joint. Long axis distraction of the subtalar joint. A to P, P to A, glide of the distal fibula. I to S, S to I, glide of the distal fibula. Inversion, eversion of the subtalar joint. A to P, P to A, shear of the mortise joint. A to P, P to A, shear of the subtalar joint. Tarsal, metatarsal, glide. Pick one phalange, motion palp. MTP, PIP, DIP, 5 moves. Knee, A to P, P to A, glide of the proximal tibia. A to P, P to A, glide of the proximal fibula. I to S, S to I, glide of the proximal fibula. Medial and lateral shear. Medial and lateral collateral ligaments. Internal and external rotation of the tibia. Patella motion. Distraction.
Can you flip over for me?
Now onto the hip. Extension. Distraction. Flexion. Internal and external rotation of the hip. Posterior glide. Glute medius muscle test.
Okay, don't touch yourself. And hold.
Navicular muscle test.
And hold your leg up.
Quads muscle test.
Bend both knees. And push up to the ceiling.
Rectus femoris muscle test.
Hold your legs straight up.
Tensor fascia latae muscle test.
And hold here.
Foot and ankle pronation protocol. Navicular. Cuboid. Cuneiforms. Metatarsal heads. Talus. Calcaneus. Phalanges. Fibular head. Supination protocol. Navicular / cuneiforms. Cuboid. Metatarsal heads. Talus. calcaneus, phalanges, fibular head, alternate talus, supine, alternate talus, prone,
You flip over.
table, alternate talus, prone, knee flex, great toe technique, MTP or IP. Now onto the knee. Knee assessment. Medial condyle, wrist extension. Lateral condyle, wrist extension. Posterior tibia, wrist extension.
I would do the medial first, and then the lateral.
Medial condyle, prone, knee flex. Lateral condyle, prone knee flex. Posterior tibia, prone knee flex.
I would do the medial first, and then the lateral.
Patella, assess and correct.
If it was subluxated superior, I would push through superiorly.
Now onto the hip. Anterior femur, wrist extension. Anterior femur, posterior glide. Assess and correct hip internal rotation.
If it was stacked internally, I would come externally and adjust it.
Assess and correct external hip rotation.
Okay? If it was stuck externally, I would come in and adjust it internally.